My name is Maria McFarland Sanchez Moreno, the Executive Director of the Drug Policy Alliance. There's so many U.S. drug laws and policies that need to be changed. The fact is the war on drugs has shaped dramatically the work of law enforcement as well as so many agencies across the United States government, the governments of the states, the governments of cities. We need to start by decriminalizing the personal use and possession of all drugs. Right now you have 1.25 million people a year who are arrested simply for possessing drugs for personal use. Those arrests in many cases lead to convictions, which can have dramatic impacts on a person's lives. For example, people lose access to housing, they lose access to employment, they lose access to education benefits. There's even an effort right now to remove food stamps from people who test positive for drugs. So this has tentacles that reaches into just about every aspect of our lives. The U.S. needs to move much more broadly towards legalizing marijuana across the United States. We're seeing significant progress. There are 9 states that have already legalized marijuana for adult use, but there's so many more states who need to do so. The federal government needs to either decriminalize at a national level or legalize. Decriminalizing would at least allow the states to decide what to do. And we need to see much greater investment in harm reduction services. In other words, services like syringe exchanges, supervised consumption sites, drug checking services, which meet people who are engaging in drug use where they're at. If they're struggling, it at least provides help to them so that you can reduce the risk of infection, save lives, and provide spaces where they can access resources and support so that they have a better chance of survival and of health. There are also other steps that need to be taken around education. There is a lot of misinformation around drugs in the United States, a lot of stigma around people who use drugs, even though in many ways we're all drug users, right? Most people use something, whether it's coffee, alcohol, prescription drugs. So the stigma that currently exists around the use of illicit drugs and the shunning of people who use illicit drugs in many ways is disproportionate and inconsistent with the reality of so many people who use drugs that also have side effects and problematic consequences. Education that is based on science, on evidence, instead of just fear-mongering, instead of just say no style campaigns, is a critically important way to ensure that you reduce stigma, but also that you equip young people with the information they need to make good choices about drugs and drug use.